I have the solution for weight loss. It's easy, simple, and cheap. But oh yeah, you gotta watch Kentucky Health to find out about it.
Kentucky Health addresses the healthcare concerns of all residents of Kentucky and surrounding states. It was created by Dr. Wayne Tuckson, a colorectal surgeon practicing in Louisville. Here is your host, Dr. Wayne Tuckson.
Hi, and welcome to another segment of Kentucky Health. Today we want to talk about weight gain, obesity, how our country is becoming a nation of, for lack of a better term, fatties. You know, the country itself is gaining weight steadily, and in particular, we here in Kentucky are leading the nation in the number of people who are overweight. What's important about this is that it's not just adults that are being involved, it is the number of kids. And the problem is so bad right now that not only do we have weight loss surgery for adults, but we now have it approved for kids. Now, you got to ask yourself, when and how did we lose control of this situation? And clearly there's got to be a better solution than having surgery for a problem that is a non-surgical origin. And with us today to talk about this is Dr. Julie Swindler, who is from the Medical Bariatrics of Lexington, and I might add is a member of the board of the American Board of Bariatric Medicine.
Well, thanks for having me today.
It's nice to have hot stuff like you here who's the big shots in bariatrics. Now, when we talk about bariatrics, what does that actually mean?
Well, bariatrics is, well, bari just means weight. So bariatrics is the study of weight loss. And the problem is when everybody hears the word bariatric, they hear bariatric surgery. And the reason why is that's one of the only fields in medicine where the surgical component actually became more popular before the non-surgical component. So that's in people's minds. But a bariatrician is a physician that actually helps people with their weight loss. That's their specialty or subspecialty, so to say. And a lot of people don't even know that bariatricians exist because it's such a newer field. But man, it is a rapidly growing field, and the amount of information that's available now to us is just growing and growing and growing, which is good because, as you mentioned, we're a growing nation too.
You know, I have to tell you a personal bias. I am very much concerned by, you can go every street corner, see these billboards, everyone is advertising, our bariatric surgeons, we can do this, that, and the other. Now, I've got to believe that, and we'll talk about some of the causes, but I got to believe that most problems as far as weight has got to be caloric intake.
Well, yeah, and you're absolutely right. The interesting thing about being overweight or obeso is it's not just one origin. One of the things that we always teach our patients is, you know, first off, obesity, the public needs to know, actually is now classified as a true disease process. It's more than just calories in and calories out, although that is a huge component. But there also is a psychological aspect, the behavioral aspect. There are tons of metabolic conditions that cause a condition, and there's a lot of biochemical abnormalities as well too. So you really have to address all of that in order to be successful with weight loss for sure. And the surgeries itself, they're a very helpful tool for a lot of people, but it's just that it's a tool. It's kind of like other things that are available. It's not the end-all cure. And I'm actually very good friends with some other bariatric surgeons, and they'll be the first to admit that if somebody doesn't change some of the things that they're doing as a lifestyle, inevitably they spend all the money for the surgery and it could all come back.
But at the beginning of the day, not at the end when we get to that point, when we look at some of the primary causes of the weight gain, again, perhaps I'm being overly simplistic, but it would seem to me that the major or the majority of the time it's more calories in than what we can possibly burn off in the course of a day.
Oh, absolutely. When you look at the amount of convenient food and high calorie foods and high sugar food and carbohydrate foods, it's exponentially growing. The amount of calories that we took in even 10 years ago is less than what we're taking in now. And unfortunately, we're also getting to be a busier nation. And that means we're not giving ourselves the time to take care of ourselves, to exercise, so we're more sedentary as well too. So you put that together, a whole lot more calories and poor food choices with being more sedentary, and boy, you're setting up the focus for failure, of course.
You know, I had one of my patients and we were sitting there talking, and she was increasingly gaining weight. And I said, you know, what is it that you're doing? She said, well, I don't eat that much. I said, okay, so clearly it's got to be what you're eating or how you're fixing it, or it's got to be something in here. So I asked her, so we talked about some of the foods, but then she said, oh, by the way, though, I drink 12 Cokes a day.
Yeah.
Now, you brought a representative of a soft drink. How many calories do we tend to see in one of these things?
You know, it's interesting that you mentioned that with the pop, and most people, if you say, you know, is pop good for you, they'll say, well, it's got some sugar in it and stuff, and you know, I guess it's got some calories in it, but it's about 250 calories, and most people don't just have one of these a day, they have several, and if you only look at calories alone, if you were just got rid of pop completely and you went down 2 a day for the year, that's 50 pounds off. That's what that equates to. Isn't that amazing? From just 2 of those a day. And when you look at the sugar content, yeah, we could flip it over and we see grams, but you know, who knows what grams of sugar looks like. This is actually the amount of sugar that's in this one little item.
Both of those things.
Both of those together. Yeah, I couldn't fit it in the one jar, it wouldn't fit. So when you think about, we're feeding ourselves that several times throughout the day, along with all the other food, you can really see how so many conditions that are affected by diabetes or by obesity, such as diabetes, are coming into prevalence at a higher rate.
It's interesting you mention that, because I recall looking at if we can decrease our daily caloric intake by 500 pounds consistently. We do that every day. We do that 7 days. That's 3,500 calories for the week, and that equals to 1 pound. So that kind of goes along with what you were just saying then.
Yeah, and yeah, so I mean, and that is the ultimate goal. Cut down by about 500 calories a day for the week is about 1 pound, and go from there. So somebody trying to lose about 1 pound or 2 a week is always a good, healthy goal to shoot for. But you know, the interesting thing is too, a lot of people don't realize there's a big difference between healthy foods and weight loss foods, and even a food that's healthy may turn into sugar, and in the end might turn into fat. And you know, a lot of times people think, well, boy, I have so much to go. If I lose 1 pound or 2, it can't possibly be that big of a health impact. And what I want to show you is this right here is what 5 pounds of fat looks like in your body.
This one thing here.
This one thing, that's what 5 pounds of fat looks like.
Let me bring this to the forefront, because that's huge.
It really is. And you know, it's funny because every once in a while I'll see a patient, and normally my patients are used to losing you know, larger amounts of weight, and I'll get someone that's like, Doc, man, I only lost 5 pounds this month. And I say, this is what you lost this month. And they say, oh, okay, I'm good.
Feel much better then.
Yeah, and you know, from a physician standpoint, a lot of people need to know too, small amounts that you make of change in your weight make huge metabolic differences on your body. You know, if you lose 5% of your beginning body weight, the American Diabetic Association has proven that that is enough to decrease your lifelong risk of diabetes by about 50%. Isn't that amazing? If you lose about 10% of your beginning body weight, you have actually decreased your risk factors for more than 33 medical conditions. So, you know, it's not that somebody has to get to like a size 4 or 0 or whatever to be healthy. They really just need to start lowering it down and to get into a more normal weight. But you know, the funny thing about normal weights is a lot of times people don't know what's normal anymore.
Well, that's what I was going to ask you. So when you talk about a beginning weight, are you saying someone that goes from 400 pounds down to 360 is going to see that same benefit? Or is that individual who goes from 300 down to 200 is when you start seeing those benefits?
It's any individual that's in the overweight category or above. And that's a good thing to actually mention to people, is what is overweight versus normal weight versus obese. You know, they did a study and they actually found that 55% of people who are overweight, their physician never even mentioned, hey, by the way, you're overweight, and that's actually significantly impacting your health. So as we're getting to be a bigger nation, what we see around us, people are thinking are more the norms. And when we see somebody who's actually normal weight, they're actually seen as being skinny. So we have to kind of look at that, because unfortunately, even though we're changing on average, medically, those health risks are the same. And we look at something called body mass index, you know, and that's a relationship in a math equation between somebody's height and weight, and it puts it into a category and range. being about 20 to 25 is considered medically the healthiest for somebody. But being between 25 and 30, that's what is defined as being overweight. And 30 to 40 is obese, and over 40 is that condition they call morbidly obese, or class 3 obesity. But either way, if somebody even wanted to know, boy, they can easily just get on the internet and just kind of look for a BMI calculator, and you just plug in your weight and height and see where you're at, and it'll let you know. And a lot of people will be shocked when they see where they're at.
In fact, I think you can go by just Googling weight loss, and some of these show up rather early in terms of the number of searches. But I have a problem with the BMI because I'm considered to be obese on a BMI. And if you look at some of our athletes nowadays, you take a kid who's 5'11", weighs 220 pounds, who's muscular, they're considered to be obese. But there's got to be a better way of trying to make the determination there.
And I'm so glad that you said that, because you're absolutely right. I mean, we talk about BMI because that's what the studies talk about, and insurance companies and everybody else like that. What you really got to look at is your overall body percentage of fat. And so if somebody is thinking about losing weight, they really do need to have a complete body composition analysis done, which is easy. You sit on this little, stand on this little machine, you hold on these little probe things, you can't feel a thing, and all of a sudden it does this bioimpedance thing where it kind of shoots the densities of a bioelectrical impedance through the different tissues, and it can calculate for you how much of you is fat, muscle, water, where it's at in your body. So when we get a printout, we can say, you know, you're this percentage of body fat, and here's where your muscle is, here's where you need to be improving upon. So it's really detailed, which is nice. But that's what's more important, because you're right. I mean, Arnold Schwarzenegger is considered obese, and even when he was in his heyday, because it was only looking at weight with height. But if you have a lot of muscle, you're going to weigh more. So you really got to look at the percentage of body fat. Typically in women, if they're over about 30% body fat is considered obese. In men, it's usually over about 25% body fat. So that's what you want to get it under for sure.
Now, let's go back a little bit to some of the diseases that are associated with being overweight, not to mention just obese. Now, you talked about diabetes. I guess that is probably the number one, I would imagine.
Yeah, and you know, in the past decade, its prevalence has increased 49%. 49%. You know, we've had to change the name of diabetes. When I was going through medical school, it was like adult onset and juvenile onset, and they can't say that anymore, because now they have to call it type 1 and type 2. Because the adult onset is now happening to kids. I had to unfortunately diagnose a 7-year-old with type 2 diabetes, and most of the time, about 95% of the time, the type 2 diabetes is because of overeating and too many carbohydrates and sugar, and all of that accumulating and messing up our organs, especially the pancreas and the insulin levels, and it's leading to diabetes at a younger age. So when we talk about the diseases of obesity, what a lot of people don't realize is, first off, a fat cell is metabolically active. You know, it just doesn't sit like it does right here on the table doing nothing. You know, one fat cell produces about 100 different cytokines and leukocynes in our body. Only one of them has any beneficial effects to the body.
Okay, so what are these? Cytokines and leukocynes? They're chemicals that tend to cause inflammatory reactions and things?
Yeah, they can cause inflammation in the body. Some of the neurotransmitters can cause signaling, so your body knows when you're starting to get hungry and starting to get full. And so biochemically, our biochemistry inside of us starts to go all haywire. And that's actually why obesity is a disease process, because yes, you can change what you're eating to help correct that, and you can change your exercise and stuff. But once something starts going haywire like that, sometimes it takes a little bit more to get it back under control. And that's why obesity actually causes 81 medical conditions. 81 medical conditions.
Such as what?
Such as heart disease, high blood pressure, high cholesterol, you know, diabetes, metabolic syndrome, gallbladder disease. It can cause cancer even, increases your risk for colon cancer, esophageal cancer, breast cancer. It's one of the best ways to decrease your risk for breast cancer. A lot of women don't realize that. Stomach cancer, kidney cancer. I mean, the list goes on and on and on. In fact, it's actually harder for me to think of a condition that's not affected by weight than one that is.
Yeah, because you didn't mention anything about some of the arthritic problems, the joint problems that people have,
that's
et cetera.
huge. I can't tell you how many people, you know, I love my orthopedic surgeons, but I don't know if they like me or not because I keep preventing them from having knee surgeries and everything. Because when you do lose that weight, you know, 1 pound of weight loss feels about 5 pounds on your knee. So, boy, that makes a big difference as well.
Now you mentioned, though, about the metabolic activity within one of the fat cells. Now, once a person loses weight, does that activity decrease?
Yes.
Okay.
Yeah, a lot of
Irrespective
it does.
of how the person goes about losing, whether they lose it because of cutting down on the calories or because they have the surgery done.
Yes, correct. Yeah, a lot of those conditions do get better. Now, one thing to remember, though, unfortunately, obesity is a chronic disease, which means it tends to want to keep coming back, and unfortunately, it tends to want to get worse. So if you think about a different chronic disease, like having high blood pressure, the doctor might say, yeah, get rid of the salt, but here, take this blood pressure pill. And if you do, your blood pressure goes down, but if you stop the medicine, it goes right back up. You know, obesity not only is chronic, but it's progressive. You know, like cancer gets worse, same thing. So it wants to go up through life. This is why you can lose weight, but unless you truly do change lifestyle changes and fix the initial problem to begin with, it's gonna come back and even then some. So it's very frustrating. A lot of people will say, yeah, I lost weight doing this program. I hated it because when I was done, I gained it all back and then some. Well, most likely it wasn't the program that they did. It was just they didn't fix the underlying condition, or they didn't help to control the chronic disease itself. And that's why you're constantly working with it, and unfortunately it gets harder and harder throughout life. And that's why too it's very important to use the assistance of your physician or a bariatrician to help somebody control some of these metabolic and biochemical abnormalities.
Well, perhaps then, let me ask this now. I've always been impressed by Weight Watchers because it's a lifestyle change. It's not only what one eats, but how one goes about fixing the foods. So how would you look at programs like Weight Watchers, and then some, I'm not as familiar with Jenny Craig, some of the other programs that are out there when they substitute foods, and as opposed to, say, like a Weight Watchers or what you may want to try to do.
You know, and I think every program has its benefits and every program has its weaknesses, of course. Weight Watchers I like in the fact that they do want you to eat real food and stuff for the most part. Now you can buy their stuff too, but they want to teach you how to go to the grocery store and eat things. It isn't more about a lifestyle change. But unfortunately, the only thing that I don't really like about Weight Watchers, I know they're changing it right now, is it just mostly talks about portion size with the points. You know, you get so much. But you know, you can eat whatever, 1,500 calories of jelly beans, and you're going to be losing weight. So it really also, you got to look at the components or what makes up the food as well. And you know, for example, the average American eats 1/3 of the amount of protein that they should every day. Well, that's huge because with protein, you get energy and it's a better appetite suppressant than like any medication out on the market. So you really want to improve that up. You got to look at that balance. Carbohydrates, good or bad, turn into sugar. You got to look at that too. Like for example, this right here, can I hold this up?
Please.
This is about what 1 cup of white rice turns into in your body. It's about 11 teaspoons of sugar. And that's rice, very healthy for you food. But in the end, boy, it still turns into a lot of sugar, and sugar unfortunately turns into fat in the body. So I like programs like that, but I would like them better when they look at what the foods are made up of, and they look at the ratio of the proteins and carbohydrates. And it's an individualized thing. The amount of protein you need is very different than the amount of protein that I need. And so it's different person to person based on their physical activity and everything too. And that's when you really start to get into it. But you know, I'm not saying somebody has to like journal every single day or add every single thing up, but it's like riding a bicycle. At first you have to learn your skill and what you can or can't have, and then it becomes easier and easier as well too.
What about some of these things though? Okay, we're going to send you the liquid portion of what you drink, and that's all you do. You just drink that. Intuitively to me, you can't keep that up, number one. And number two, what am I missing in terms of vitamins and things? I always get nervous when something doesn't include fresh fruits and vegetables. Now, am I missing something? Because your point about the stuff bounce, you get this rebound afterwards. You always see that with these things.
Yeah, you know, and a lot of people ask that too when they say, you know, can I do the liquid diet or something? And the answer is, well, number one, you always want to do that under a physician's supervision, because what happens is your electrolytes can switch very, very quickly on those diets. like your potassium levels. And when you have very low potassium, all of a sudden, that can set you up for an increased risk for heart arrhythmia. People have died from that. So if they're doing a liquid diet, it definitely needs to be under physician supervision for sure. But you're right, the problem with that, the only time I really like using those is somebody says, I have this upcoming surgery, I have to lose this much weight by this time, and they have a timeline and it's crucial for us to get that off. Then yes, you will lose weight faster that way for sure. But the problem is, like you said, you can't eat that the rest of your life. And what happens is, once you go back to food, unless somebody very specifically knows how to transition back into real food, it's very easy to gain that all back. So that's what's called a protein-sparing modified fast diet. And if a physician is trained in weight loss, they should know how to do that one appropriately. So it is appropriate for some people, but you're right, it's not long-term, it's not safe long-term either, and you're not getting all the nutrients you need.
The other thing I hear, I'm going to have this bag of potato chips and drink this soda, but I'm going to get out and run, though, and try to burn those calories off. And I think that when you look at it, the number of calories one burns exercising versus what you can't do it.
No. There are 3,500 calories in 1 pound of fat. So if you go walking a mile, on average, you burn about 100 calories. So if you do the math, you'd have to go about 35 miles to lose 1 pound of fat from exercise alone. But if you eat 2 pieces of cheesecake, and I can do that in 5 minutes. That's enough calories for also 1 pound of fat. So if somebody's concerned about their calories, they really got to fix it with nutrition. That's the easiest, fastest way to do that. But don't get me wrong, exercise is a very important process and component to this whole weight loss. It's just for completely different reasons. We never exercise to burn calories because, as you just saw, we just don't burn that much. The purpose of exercise is it will boost your metabolism. It will build muscle. Muscle burns fat, and that's why ladies, I definitely want them to be burning more with the exercise just because they'll be building muscle. And number 3, it helps to prevent plateaus. So if somebody's in active weight loss, their weight loss is nice and smooth like this. If somebody's not exercising, they lose, it stops. They lose, it stops. So it takes longer and it's more frustrating as well too. But 2 things have to occur for it to even count as exercise. You can't just go through the motions. Number 1, your heart rate has to be elevated above baseline. And number 2, you have to be breathing a little bit deeper than normal. It'd be almost like if you're going for a walk and someone calls you on your cell phone, they should say, "What is wrong with you?" Because they can hear that increased respiration. So no matter if somebody goes 10 minutes or 45 minutes, you just want them to really get that heart rate going a little bit. But again, too, you always have to put the plug in that if they haven't been exercising, it's important for them to talk to their physician about what they can or can't do based on their medical history.
My intent with this is not to say that there is not a disease process of obesity. I agree that there is. But I'm oftentimes reminded of a cartoon, and I'm not saying the situation is cartoonish, please, but if a patient is in front of a physician and the patient is saying, "Doctor, yes, the reason I have gained all this weight is because I have a gland problem." And the doctor says, "Yes, that and the fact that you eat 3,500 calories a day." Again, at the beginning of the day, I've got to believe that if we can alter people's habits and alter these dietary patterns, we're going to be a big step toward trying to control the weight problem.
It's huge. The kids that were born after the year 2000 is the first generation that will not outlive their parents. We're dying younger now is what that's saying. And it's because obesity is the #1 preventable disease that's out there. It's an epidemic, which means if it's preventable, yeah, you're right. There are metabolic things, there definitely are things that can cause it, but the biggest component is what we're doing, and we definitely can change it. Even if somebody has been overweight or obese since the time that they were 6 years old, it doesn't mean that they can't get to normal weight now, but they need to know how to do it for sure, and they have the ability that they can.
Well, I want to tell you, one of my heroes was Jack LaLanne, and he just recently passed. And he was a guy who believed in responsibility. Exercise plus eating properly, said, will make us all healthy people. And I think that he was absolutely correct. I really encourage you that if you want to find out more information about weight loss and what you can do, number 1, contact the Medical Bariatrics of Lexington, and you can see the address where you can contact them there. But also just Google weight loss, and you'll see a lot of different things that are mentioned that are pretty easy to follow. Things talking about caloric intake and how to keep a diary. I think it's a very important thing to do. Exercise that you can do. Not so much exercising that you're going to really burn off all those calories, but in conjunction, I guess, with the dietary intake. So it's very important, and there's some good information that's out there. And of course, if you are going to start an exercise program, do talk to your physician. And if you're really looking at trying to lose weight, again, talk to your physician, because it's very important that you do these things in a controlled setting. I'd like to thank you very much for being with us. I'd like to thank you very much for being with us. And of course, Julie, Dr. Swindlen, thanks for being with us again. Again, if you have questions or concerns, contact us at KentuckyHealth@insightbb.com, or feel free to contact the good people at Medical Bariatrics of Lexington. Look forward to seeing you again next time on Kentucky Health.